Good morning. John said we're on now, so I get the signal from the back. And thank you so much for being here. We are excited to have two people this morning. We have Liz Coates, the Executive Director of Good News Clinics, and Cassie Strobin, who is the Development Director. So we have two for one again this morning. So Liz is the Executive Director. She has a BA in English from the University of North Georgia and a Master of Arts in Christian Ministry from Mercer University. She has been with the organization since 2017 and originally served Good News Clinics as the development director before becoming executive director in 2019. Liz's most enjoyable part of her 11-year congregational ministry background was when the church interacted with nonprofits providing direct services to individuals and families. Her transition into safety net health care was one in passion for participating in creative ways that communities can leverage their gifts and abilities to ensure that everyone has health care they deserve. Liz is married with 3 children, and they reside in Gainesville and love our community. Let's welcome Liz and Cassie.
We'll be together. Good morning. Happy Friday coffee group. Friday coffee morning. Did you know that it was raining outside a little bit? We're so excited. We haven't had rain in so long. I was thrilled to see a rainy day today, not because I just enjoy it being gloomy, but because we need it so badly. So, yes, thank you for the lovely introduction. Miss Mary's been wonderful to work with, and I think I was a bit unavailable at times, and she was very patient with me, so thank you for that.
I was just in a little panic.
You know, nothing like a little construction project to keep a girl busy, so we'll talk about that in a minute. But first of all, we just really appreciate the opportunity to come and speak, and we hope that this can be dialogue, so jump in with questions at any time. Ms. George, I didn't get to speak to you yet. It's nice to be among some friends that I certainly have met through the years. And I will start, because I am in charge of my clicker, with who we are. So, the mission of Good News Clinics is pretty simple, but the way we execute that mission is pretty complicated. So, Miss Silky's here too. I'm sorry, I'm just saying all my hellos. I need to stop. So Good News Clinics provides free health care, comprehensive health care, to low-income, uninsured Hall County residents. Hall County is a-growing, if you've noticed. It is a-growing pretty quickly. So we feel that in our organization, most certainly. So I want to talk a little bit about the history, and then I want to touch on our values and our what it takes, sort of that implementation piece that I was telling you about. So 33 years ago, Dr. Dave Westfall, Susie Harris, a small group really of people got together, and they realized that we had a problem in our community. The problem, I'm staying behind the gold thing, the problem is that we have folks who don't have insurance, can't afford to pay out of pocket to go for medical care. And so where do you have to go? What's the only place that will have to treat you and take you? ER. Emergency room. So you have frequent flyers, if you will, who are constantly in and out of the emergency room. They get stabilized, right? So let's just take the example of diabetes. We get them stable, no longer in crisis. We send them home without the ability to have insulin, without the ability to learn all the things that need to happen so that they stay stable, without the ability to have their A1C checked every 3 months. So, of course, what happens to those individuals? They end up right back. So this problem was happening, and Good News Clinics was really born from that. So when we started, who knows about Good News at Noon? Who knows we're different? Yeah, okay. So we love Good News at Noon. We take care of a lot of the same people. Good News at Noon is a shelter and feeding ministry. Good News Clinics started next door, and we were originally the Good News Community Health Center. And we started next door because a lot of the population that needed us was in that part of town. So we were right there where we needed to be off Queen City Parkway on Dorsey Street. And we had a very small metal building that was our first home. Clint Hawkins, did you ever work in the pharmacy there? Okay, we referred to it as the closet, because that's pretty much what it was, this tiny little space. Who was a drug runner? Miss Ann George was a drug runner. So here's how we operated. We had a few volunteers who came in for the first 13 years. This was volunteers only. There was no paid staff whatsoever. So we had, not the first 13. Roughly, yeah. So around the first 10 or 12 years. It's all volunteer run. So you've got Miss Ann and Clint and maybe a few others in this room and a host of others who they go around to doctors' offices and they pick up the samples and they bring the samples, and that's what's used for these volunteer doctors to treat the patients that they're seeing. So that was sort of the most grassroots possible beginning you can imagine, right? I mean, I just think it's beautiful. I think it's wonderful and such a beautiful vision. So this started 33 years ago in 1992, roughly, and it has grown nearly 10% year over year since. So it's really grown and grown and grown over the years. And we just finished our data from our fiscal year that ended in September, and we served a total of 3,014 unique persons. So that's 3,000 bodies with comprehensive health care. So if you come for more than one service, we might see you in many departments for many things. So let me dive into what those departments are. And this is where that implementation and why we're a complicated little place. When I imagined a free clinic, and honestly, it was when I was working in church life before. I had never visited, so I didn't really have a full understanding of what this little free clinic was doing. And so if you've never been, what do you imagine when you think about a free clinic? I think about like a walk-in. You know, people come for sick visits. That's really what I imagined. Now, this is a full-blown primary care operation that has a dental department. So we have the Sample Medical Clinic. Some of y'all, of course, knew Dr. Poole. We have the Green Warren Dental Clinic. We have the Silky Eye Clinic. We have the Ed Nivens Medication Access Program, which is part of our dispensary, because without medication, what good can we really do in many cases? We have a counseling program. We have a referrals program. And we have an in-house lab. I used to say 5 departments, and now I say 7. Because what happens over time, and Ms. Linda could tell you about health access because you helped get that started, is the coolest thing. So we'll come around to that. But so essentially what started as some drug runners and some doctors showing up on the mornings that they could to see a couple of patients has turned into an operation 33 years later that is seeing over 3,000 people every year for medical, dental, mental health, getting their medications refilled, getting their eye work done, all of those things. So it's become this comprehensive place. Here's what we've not done in 33 years. We've not wanted to duplicate the services that can be accessed elsewhere. So here's a for instance. Children are able to be seen at the health department for dental work. So if you've got children who are uninsured, their parents have not enrolled them in peach care, whatever the situation is, but they need dental work, they can be seen at the health department. So we don't see children in our dental department for the most part. But adults, on the other hand, they have to pay out of pocket if they're uninsured. By the way, a lot of Medicaid, even if you have dental in your coverage, it's not accepted by many dentists. So people are still kind of lost in the adult world when it comes to dental. So that gives you an idea of how we've tried not to duplicate services that are available elsewhere. So we are grassroots, complicated, and pretty comprehensive and amazing little program, which is what drew me to this place when I began 7 years ago. So she's going to do my slides for me because I'm forgetful. So here's the who we serve. So, oh, I forgot to talk about our values. I'm sorry. Go back one. I did want to bring this up. I think that Good News Clinics is a Christian nonprofit, so that's a big piece of the foundation that we stand upon. And while we're not going to proselytize and make people who may not share our faith uncomfortable, we do intend to live out our faith, and we've provided space for that in our organization. And one of the things that I love is that when volunteers, medical providers, even some of our health access. I have a surgeon who was on our board for quite a while, and he said one thing that he loved so much about volunteering to see our patients for free in his operating room was that he always had the privilege of praying with that patient beforehand. And he knew how meaningful that was, not only to the patient, but for him, because he was having a reliance on something bigger than himself and his skills and his training. And I just thought that was a beautiful thing to share. So with our values, collaboration, we are built on collaboration. I'm going to put Cassie on the spot. Who are some of our partners that make it happen?
Like our community partners?
Mm-hmm.
One of our biggest community partners is Alliance Prosthetics, who comes through every single time. If we have a patient with a missing limb, they will give them a prosthesis for absolutely free. They, on top of that, also donate money to the clinics and give their time in the clinics as well, but we can send our patients to them. And it's just one of the most fantastic partnerships that we have.
Another one would be the hospital. So we keep people out of there who can't afford to be there, and we keep them stable and well so that they don't need to be there. So that's good for the patient, clearly, obviously. But it's also really good for the hospital because that's charity care that they don't have to use, essentially, right? So we are able to keep their emergency department from being as full of things that can be managed on a daily basis. So when you think about the cost avoidance, as well as until our new ER opens, you all know how crowded it is there. We don't need sick visits in the ER, right? So our existence helps them, and here's a few of the things they do for us. They help us with funding some. They take all of our imaging. So through our health access program, that referrals department, if our doctors decide that somebody needs to get an MRI or any type of imaging, mammograms, that's another big one, because preventative care is so important. So we're able to send those patients over to the hospital, and they absorb most of that imaging cost. Otherwise it couldn't happen. So they do a lot of things like that. Surgical space, when that surgeon from Longstreet Clinic does a breast cancer surgery for a patient at the hospital is absorbing the cost of the ancillary things that come along with that surgery. The surgeon's donating his time. So you see the collaboration? It takes everybody to pull this together. And that's why I love this place, because and I'm just going to go ahead and say this is like my line, is that's the kingdom of God. That's what it looks like. It's everybody joining in together for the greater good of all people, because we see the image of Christ in all people. And so for me, that was sort of the draw. You saw my background. I had never did healthcare before, and I thought I am not qualified to fundraise maybe, but not to be the director. And here I am 5.5 years later, realizing that administrative gifts are all you really need, and a whole lot of determination. So healthcare never seemed like the place for me personally, but it is the kingdom of God, and that is for me. And so that's kind of how I ended up here. So collaboration, compassion, I think that point is pretty clear. People who have no other place to go, and this is their last stop, are treated with respect and are compassionately cared for. by a lot of people who live with such integrity, because those volunteers' names are not posted outside for everyone to see. People don't know who come and go to take care of folks and literally wash the feet of diabetics who might be homeless and have wound care problems. Like, people don't see what we see. This is hard work some days. And these volunteers, they don't do it because people are paying attention. They do it because they have integrity, and it's part of their own personal value system. And that's the beauty of it, is everybody who comes to work at Good News Clinics wants to be there. How many of you worked somewhere where not everybody wanted to be there all the time? So we rely on volunteers. Everybody wants to be there. That's really cool. The other piece is stewardship. So I guess while we're on this volunteer, stewardship looks like a lot of things, but I think one of them is that we are able to, who are my numbers people? Got numbers people, and there we go. We're able to produce some $18 to $20 million in services on a $2.5 to $3 million budget. So stewardship is taking what we have and only using what we need, and relying on the volunteers and the partnerships and the collaboration. Because you know, it's a lot easier when something's generating revenue is to just write a check. That's a lot easier, but that's not what we do. So what we do is practice stewardship in all things. And so that's a big piece of who we are. Okay, now I'll stop. We can scoot. Okay, so who we serve. Do you want to tag in on this one, Cassie?
Sure. We presented this at one of our events this year, and it just gives you a good picture of the type of people in this community that so desperately need the help that we can provide them. So you're looking at kind of the typical maybe family of 3 here. We loose numbers, but in order to qualify for Medicaid, that family would need to make $33,000 or less a year. That's, I didn't put the second slide up here, but that's 2 people working for basically $10 to $15 an hour full time, and then a child in that home as well. That's kind of what their income might look like. Now, to be even remotely stable in the state of Georgia, you should be bringing home about $74,000 a year. That's not to get to go do all the fun things all the time. That's just to be comfortable, to be able to pay those basic bills, maybe a couple incidentals each month. You can be considered stable, rather. Now, that leaves a huge gap of people making between that $33,000 and $74,000 a year that can't afford insurance, can't afford maybe even their car payment. Rent is crazy these days. And so the people that fall in that gap are the people that we see in our clinic. And it just puts it into perspective that there's so many people out there that need our care, and we can help those people.
Yeah, so I feel like that paints a good picture. And we had a family that came in this week, and so we have a husband, we're just going to call him Jonathan, and a wife, we'll call her Maria. They actually have 4 children, and they came in because Maria has been experiencing some mental health issues that are quite significant. And she was well managed for a long time, but they moved here from another state, and she hasn't been able to access care yet. And he is the one working, but the income is not enough to sustain the family and to purchase insurance for her. And so here she is, desperately needing medication. And they were able to come to the clinics, apply, and we're going to be able to get her in with one of our partners. The graduate medical education program at the hospital now has a psychiatry residency. And they come over on Wednesday mornings and help us with patients that might need that service but are having trouble getting into our state-funded program, for example, because there are just too many people that need that support right now and not enough help in the state-funded program. So that's just one example. And, you know, because she's there, we're going to do a medical workup, and we're going to see what else might be going on. It's amazing the things that we catch when people have put off healthcare and put off healthcare because they could not afford it. It is not a well visit by the time people come to us. We're not doing a lot of well visits, unfortunately. People come to us because they have had an incident or something has deteriorated to the point that they've got to go find care. And unfortunately, that's just not your priority when you're not making ends meet. Making your ends meet, that's the priority. So that's kind of who we see. To give you a little snapshot of what it looks like in our clinic, so we will see today about between 50 and 55 medical patients just in our medical clinic. We will see, actually we have Augusta dental students there today, so 4 of them, so we have more chairs going, which means we might see as many as 20 or 24 dental patients today. And in our dental clinic, we just do the basics. There's nothing fancy or expensive going on. We're doing basically infection control. So we do fillings and extractions. We do the exams and x-rays for them before that. And then we offer cleaning service, and that's it. And the cleaning service is new, but if we're not doing prevention, we're gonna have to do more of the extraction and the filling, right? So there's a big movement toward trying to help families learn preventative care and change the cycle of their family. You know, so many people have grown up and these cycles of poverty are really significant. So we go, how can we help change a family? There was this one patient, loved her, Daisy, and Miss Daisy had 3 little kids at home and she was having panic attacks for the first time in her life. She's the cutest young woman and just, you know, kind of doing her thing. Her husband worked, but they didn't make enough to afford insurance for her and the family wasn't covered. So she came, and what we discovered though when they went to help her with the panic disorder was you are pre-diabetic as well. So she's in her early 30s, but she's no longer pre-diabetic because she got to see our registered dietitian and she got to go through our diabetes management education program. And the first thing she did when she came back and we saw her glucose and A1C plummet to a completely healthy non-pre-diabetic range was, oh my gosh, I can't believe I've been feeding my children wrong the whole time. So you see how this can change family cycles over time as well. Just that intervention and that opportunity to work with people who just don't know and haven't had the opportunity for that. So we'll see about 50, we'll see about 24 in dental, which comes to about 1,000 medical appointments per month. So what I learned when I toured at Good News Clinics was that for the first time 7-8 years ago, it was not the sleepy little walk-in clinic that I thought it was at all. It's a bustling. And so that's just a piece that I think that I like to frame for everyone. Our counseling program is also seeing around 200 appointments per month. Another partnership there, collaboration, is the Grinnell University has their counseling and their Doctor of Psychology program now that's new. And they have clinical interns who need 1 year of clinical rotations. So we get a Grinnell 4th-year student from the counseling program. We might get 3 or 4 students with us for a whole year. And those are unpaid interns. So you see how all this works. Just continuing to underscore that. So we have 2 paid counselors. We have a paid pharmacist, and we have 2 paid nurse practitioners and a registered dietitian. And then we have 95 volunteer physicians and dentists and nurse practitioners and PAs. So this little bit of paid licensed professionals with this lot bit of volunteers, that's how we make it work. And then all of our medical assistants and dental assistants are paid staff. So we have ended up with around 30 employed because let me put it this way, if your volunteers are not happy when they come because things are difficult, I was talking to a dentist yesterday, and he said, I don't enjoy going to this other clinic that I was volunteering at because they just don't have everything I need, and there's not a dental assistant, so everything goes so slow, and I just feel like I can't make as big of an impact there. So see, employing these assistants, and also they're all bilingual, so we're able to be bilingual for patients who only speak Spanish. So it's just important that we have all that support staff in place and it's what makes it all work. So I just wanted to share that as well. Okay, so y'all might have heard that about every, I'm being silly, you might have heard that about every 10 years we are bursting at the seams and have had to grow. And so here we grow again. We originally started, like I said, on Dorsey Street, and then we moved over to the corner of High and Pine Street. So if you know where Queen City Parkway and Jesse Jewell intersect, we're like in that block, right? So if you turn in that block, there's the water department, the skate park, and that new Midland walking trail, and there's us. And we're the one under construction because we've had to grow again. And so we're very excited and thankful to have been able to do that. So we set out, basically, let me give you the quick snapshot. In 2017, we started feeling the need to grow. And the way we measure that is we can't get to people fast enough. And so they're getting sicker, and they're ending up back in the hospital, for example. So as a new patient, it might take a while to get established with the doctor sometimes. We cannot afford that wait time because people are very sick by the time they come to us, unfortunately. So our wait times have to be at a minimum for us to really be helpful. So 2017, we realized we need to grow. 2019, we bought an adjoining property with an 8,400 square foot warehouse. And we thought, okay, we've got a renter, we're gonna take some time, raise some money, and then 2020 hit. And the world stopped. And we did too. Well, we didn't stop anything, we ramped up, just not expanding our facilities. We ramped up and, of course, entered into the COVID relief process with the rest of the world and healthcare. But by 2021, we were ready to go, and we had an estimate on what it would take to renovate this warehouse and to expand our facilities. And we worked with architects from the hospital who had all of the regional data about who's insured, who isn't, how many people are in poverty, how many aren't, where do they live. And they helped us basically put the numbers to what we needed and validated that we needed to add at least 60% more medical capacity, which meant pharmacy and lab got to grow with medical, right? There was no other place for eye care, so we needed to at least double, triple that. And then we also needed to expand our mental health counseling program. So when I started in 2017, there was one counselor, and that was it. And now we might have 4 or 5 there on a given day, depending on intern schedules. So that's what we set out to do. We figured out how much it would take to undergo the capital project. We set a goal of $8 million. And for those of you who have participated with us in that, we're very pleased to tell you that we have raised almost $8.3 million now. So we're very thankful. Yes, we are. Oh, she just reminded me that it's 8.9. How could I forget that? I don't think I forgot. I think it's new information, though. It is new information. So, yes, we're at $8.9 million, and we're going to push our goal up to $11 million because we've got to be able to work on our endowment a bit to keep it meaningful for our organization. And we're going to need a little more operating support to reserve so that as our budget grows, we're able to support that with the expanded facilities. So we're just really blessed and excited. The community is our greatest funder, so people often ask who funds you. It is this community. So we're very thankful for all of those who participate with us in this. And then the hospital provides 1/4 of our expenses every year. So, you know, not even $1 million is somewhere over the years. It's been between $400,000 and $800,000 that they typically are providing for us, and we are saving them somewhere in the range of $3 to $5 million just in the ER, not other things, just with the ER avoidance. So it works out great for everybody. So let's see. I think we already that slide. We did talk about this. Oh, the quick update, though, for those of you who've been involved, too, is that we should be completely finished with our project in December. So we're very excited that we're almost there. You can see everything now. It just doesn't all have sheetrock yet. But we were committed, and it's taken a while. It's taken over a year because we had to be committed to staying open because our patients, there is no other place to send them. There's no other place to go. So we have lived in construction. Y'all ever done that? We have lived in construction for over a year now, and if you ever encounter any of our staff or volunteers, you tell them thank you for putting up with the jackhammers and all the noise. Yeah, all of it. So they've been wonderful to stand by us through that, so it's been great. So not so much this slide. I really want to actually just focus on, let's go right to the last, patients. We did talk about a few of our patients, but I want to jump right to something that I'm excited about, and it's a surprise. Okay, I needed some anticipation. Thank you. Thank you for that. Okay, here we go. So every year, Good News Clinics, we select volunteers of the year. We select 2 volunteers. One is a clinical volunteer, meaning a physician, a dentist, a nurse, somebody like that, a licensed clinician. The other is what we call a community volunteer. These are the people that show up and say, I will do anything you need me to do, basically. And we put them right to work, doing all kinds of things. And so our surprise this year, and the reason I'm so excited, is that Clint Hawkins is our volunteer of the year. And he didn't know. Clint, I'm not sure how many years you volunteered in our pharmacy. Are you?
About 32.
See, that's why I didn't know. That's right, since the beginning. 32 years of giving his time gladly, compassionately. We're so grateful. Our patients benefit. So thank you so much for all the years of service, for always being happy to be there, and for supporting our pharmacy team in the way that you do. Because he can tell you best, that's one of the busiest little places on the planet. They're pushing out 4,000 plus prescriptions every week on a staff of 2.5. And they rely on people like Clint to come in and help them. So thank you for all that you've done, from drug running 32 years ago to pill counting this week. We appreciate you so much. So thank you. I wasn't sure if he was going to be here this morning, so when I saw him, I got excited and I had to poker face, I think our patients are the reason that we do what we do. I work in administration, right? So I don't do the patient-facing work that a lot of our team and volunteers do. So I have to be very intentional about not losing touch with my why I do this. So one story that's really easy for me to tell, and his is not even on the slide, can I tell it again, Ms. Francis? I'm gonna tell it again. Okay, good. So we have our Silky Eye Clinic now that the Silkies have helped us with. And recently we were able to start a retina program. So retina is a very much in-demand specialty. It is hard to get. We have never had this service before, but we have some 700 plus diabetics who not only need an annual eye exam, several hundred of them are dealing with retinopathy. So they're having intense vision decrease. So as their vision becomes more poor, it's preventable. There are injections, there's intervention for that, there's treatment for that, but not if you can't access it. And that's the worst thing to think about, is I'm literally losing my independence because I can't access something that's readily available in the world. So one of our patients, we happened to have, so Whit and, Whit was in town one day and they'd gone to lunch, and they called and said, we're just gonna swing by and check on the clinic and the progress. And I'd said, oh good. They popped by and we happened to have retina clinic that day. And out walks through the hall and just passes, and right now we're in construction, so everything's tight. So Miss Francis walks right by one of our patients named Ricky, and we love Ricky so much. And he's young. Ricky's in his 30s. He had some heart issues, some cardiology problems. He has basically a family history that's not in favor, and so at a young age he had onset of cardiology issues, and he developed diabetes as well, which is something we see commonly, is 2 chronic conditions that are quite serious in the same person. So Ricky came to us after an incident. He'd been in the hospital and was discharged. And so because he'd had unmanaged diabetes from not having care, he had developed some retinopathy and was beginning to lose vision. So Ricky was there that day because now he's lost over 100 pounds, and he is in his diabetes, he's in good management now, and he is no longer in heart failure. He's doing really well, and he's back at work. So he is working again and able to take care of his family. And he's got this lighter and breezier way about him than he did just a couple years ago. But the day he was there at Retina Clinic, he had just gotten his injections and he had his eye patch on. And we passed him in the hallway, and I said, Ricky, how are you? You know, we're chatting for a second. I said, this is Miss Francis. She helped get this eye clinic going. And I think that he looked at Miss Francis and he said, you've helped save my life. Thank you. Because that is exactly what it's like for our patients. With nowhere left to go, it is people like Clint and Miss Francis and Ann George and all these wonderful people, Miss Linda, who are able to come in and make it possible for them to get back to the business of living. That's important. It's important work. So I did want to share that patient story, and I think that for the most part, what have we left out? Questions. Okay, they're getting the mic. Perfect. Yeah, we'd love to hear any questions y'all have or comments, anything at all. Yes, ma'am.
Well, had you thought about telling how the clinic started at the very beginning?
So at the very beginning, I know that we had Dr. Westfall and Susie Harris, and I'm going to leave some names out because I wasn't around yet. So I always get nervous telling that story. Linda, chime in if you want. But Gene Beckstein. Okay, the Mr. Beckstein. So Mr. Beckstein, and it's funny because actually in my notes I made like Dr. P and Dr. B because I'm used to saying Mr. B. So Gene Beckstein, known as Mr. B, was a middle school teacher, had a huge heart for the poor, basically, and the homeless. He is probably the most fondly remembered human being in this community of anyone I've ever known about, and that's saying something because this community has some fondly remembered people. So he got the good news at noon, shelter started, and the feeding program, and it was basically working in the streets with all these folks that just needed help. He started doing stuff with the kids, and they organized lots to make sure people had hot meals and a roof over their heads. And he knew that that medical care was so important and that so many of these people were very unwell and couldn't access care. And so part of his vision was this medical clinic. Well, healthcare is a little regulated. It's pretty, it's very professional skill. There's a whole lot to it. So that's a lot to manage under one big roof. And that's where this was born out of. It was part of Mr. Beckstein, Mr. B's vision. And it came to fruition because of the skilled clinical people who came alongside him, as well as local congregations. So, what I call the big five, the tall steeple churches, everybody got together and put some money in and helped get things going. And they were able to secure that first little metal building. And then they actually started seeing patients in the shelter in a space that I have heard was it was basically had been a handicapped restroom. And that was like the exam room because you work where you can work. When we think about third world missions, we imagine difficult environments to work in, but we forget that that's anywhere. That's anywhere you go that people can't get to the comfortable exam table or the comfortable dental chair. One of our dentists was telling me yesterday that he has pulled teeth just sitting outside under a tree. In a lawn chair. In a lawn chair, yeah. So we don't think about it, but that's how things get going. So it came from the vision, which is why we have proudly and gladly kept the good news part of our name, the good news clinics, because we don't ever want those two, that origin to be completely separate. And now we take care of a lot of the same people, not all the same people, but a lot of the same people. So that vision continues for sure.
Liz, a lot of people here would know Dr. Sam Poole.
Yes, Dr. Sam Poole was the first medical director of Good News Clinics, and he came in at a very young retired age and made it his full-time job to see patients every day. Clint could tell you better than me. I wasn't around then either, but I think he was there for 13 years. Well, he went to Dr. Ed Burnett after the first 2 years. So in 92, they got going. In 95, he goes to Dr. Burnett and he says, I can't keep treating these abscessed teeth with antibiotics. They got to come out. So I need you at the clinic right away. And if you knew Sam Poole, you knew that's exactly how it went. You were voluntold every time. Voluntold. But people listened. And then after Dr. Sam Poole, Dr. Jim Butts. Dr. Jim Butts became our next medical director. He did that role for 12 years, and also just not only brilliant and faithful, but imagine how much this little organization that started as I described was evolving over these, is that 25, 24 years? I mean, it was really evolving. And so they saw us through so much change and so much growth, and then moving to the new building, which was an old, MedLink building, and the clinics bought that and added on to it, and that's when the Health Access program, which Health Access, Linda can tell it better than me, but the Health Access program is our group of volunteer specialists out in the community. So think about any specialist you've ever been to. You know, you've got gastro and ENT and all the different, surgeons and whomever, and ortho. I just could go on and on. All of these specialists who, they can't do what they do in our office, so they allow us to refer patients to them, and they see them for free in their offices. So literally the agreements between those physicians that Linda probably put in place still exist. And we've added over the years, and people roll in and roll out, but that's how we get all this care taken care of that we can't do in a primary care office. Because I'll tell you, the worst feeling a physician can have is, that's as far as I can take you, I'm sorry. Knowing that there's care. Yes, Ms. Match?
I'm sorry, but was it all this started from an idea from one person who didn't have the money, just had the idea. He was a school teacher, and he literally started it out of his own brain, and it has grown to what Liz is talking about.
So I'm guessing you probably knew Mr. Beckstein.
Did you know Mr. Beckstein?
Yeah. Mm-hmm.
Yeah. See, I wish I'd had the opportunity to know him. I never got to know him. And so to hear from people who knew him well, I feel like he's quite the legend, and he birthed a lot of things that I think have sprung out of his vision besides Good News Clinics. You look around at just all these different nonprofits that what's happened is, I think he had this vision, and then we see, oh, well, here's a different problem that this population has. Well, we need to start a nonprofit to fix that one, that new problem. And it's kind of been a springboard of things. So whether all of it was his original brainchild or not, the ripples, man, saint, yeah. What other questions or thoughts?
What are your volunteer opportunities?
Great
or
question.
needs?
One is we have volunteers who work with us in the mornings alongside staff to do our intake process for patients. So patients have to apply for our services, and we have to vet them, that they indeed are uninsured, live in Hall County, and their income level is low enough for us to see them. It is rare that someone who is not eligible applies, but the volunteers sit down and help with the paperwork, go through everything, and give a little bit of an orientation about the various services that we have. After 1 year, every patient has to renew, so that if their circumstances have changed, we know if they're still eligible. So at 8 o'clock every morning, Monday through Thursday, we have volunteers who work alongside staff to sit down and go through that process. We have a training process for it, for those volunteers. A second opportunity for non-clinicians, of course, all the doctors, dentists, nurse practitioners, etc. Another volunteer opportunity is the food market. And so we have on Fridays a fresh fruits and vegetables market because our dietitian is saying you need to eat the fresh fruits and vegetables, and our patients are saying, I can't afford it. It's so expensive at the grocery store. And so we started working with J. Moore Farms, and we basically sell fresh fruits and vegetables at wholesale prices that allows our patients to afford it better. And so we have volunteers, completely volunteer-run market, and it's pretty cool. It's pretty fun, and beautiful produce. So, and then another opportunity would be, what did I just think of, Cassie?
While she thinks, though, I'll
had
talk about the
something
food
else.
market just a little bit because we hadn't touched on that. That's the new program that we started this year. And there are lots of opportunities there that are all very easy. We have one staff member that helps coordinate the food market, and she's the best at coordinating our volunteers, but she brings people in more than for just the actual food market to help run it, take transactions and that kind of thing. She brings people in the day before, volunteers in to help count the produce and stage it so that it's ready to go the next morning for the market. I mean, there's lots of opportunities there within the food market to volunteer. So that's the one I always tell people about.
I remembered, thank you.
Yeah.
There's phlebotomy, there's pill counting, there's also doing injections like vaccine injections and things like that. So anyone who's certified in anything like that doesn't have to have licensing, just the certifications and some experience, those types of things. And the pill counting, I mean, if you can count, you're good. Yes, sir, Mr. Strother.
Liz, again, Linda, or one of them could answer this probably. But it seems like to me one of the reasons Mr. B was so successful in his board is that they refused to take any government money. So that allowed them to do things that they wouldn't have been able to do otherwise because they didn't have the government to tell them what they couldn't do. Is this still the case with the clinic?
Great question. Yes, it is still the case with the clinic. The story goes that there was a time under Dr. Poole, so the clinic was well established at this point, a good 13, 15 years in, and the clinic was approached by the federal government to say, hey, would you like some funding? And it took Sam Poole no time to say no. They told us we would have to take that painting of Jesus off the wall, and they lost me then. And that is the truth. There are so many restrictions, and in many ways, federal and state money, there are lots of programs for people that qualify for federal and state money. But it's difficult. There are people who don't qualify are still people. They're still human beings made in the image of God, and they still need help. And that's why a place like us needs to exist without the restrictions and with the vision that Mr. Beckstein started. So we proudly do not. The only time we have accepted any government money was from our local Hall County government, and they granted us, during the COVID pandemic, they granted us money to help towards our immunization clinic. And so it comes with no strings, none at all. It was capital money and allowed us to build that space. But it came with no strings other than show us how you spent it on your building, and we did. Yeah, thank you.
We got one more.
Other than money, are there donations you'd like to have? Medication, is that possible?
Thank you for asking that. Actually, I'm so glad you did. Yes, so medications that are still sealed and unopened, we welcome those, absolutely. And if they're unexpired. So we cannot dispense unexpired, or if it's just a regular prescription bottle, because that could have been tampered with. So we can't accept those. But if there's anything sealed and unexpired, yes, we want it, we need it. You can drop it by, honestly, any time to either building, and we will get it to the pharmacy. Thank you. And other things, it's difficult for us to take much equipment in the way of, walkers and things like that, because we don't have the space for a lot of it. So we take a little of it and we keep a little on hand. I mean, I probably have 20 crutches and 5 walkers and 2 wheelchairs right now, and that's about as much as we have the space for. So call us if you want to donate something like that, because we'll let you know if we can take it right now or not, and sometimes not. So the other types of things being medical supplies, it goes along the same lines. Remember that we are not inpatient care, so we don't need anything that would be for inpatient, things like I can't think of it right now, IVs, things like that. We're not really doing a lot with things like that because we're outpatient. But, bandagings and things like that, we take those. And right now we have a surplus of them, so we don't need them. But, when you hurt your foot and you get the boot, or you hurt your back and you get the band or the sling, we do appreciate things like that. So we just have enough right now. So I'd say call on any equipment or supply type thing, but just bring the medications as long as they meet the criteria. Thank you.
I just think it's so important that everybody understand that because of the quality of the medical staff, people, the doctors and nurses, that the people at the clinic get the same level of care that all of us get in this room. It's just as good.
That is a great point. Thank you for making it. And I can tell you that the same doctors you see at the NGPG offices and at Long Street Clinic and in some of the private practices are the ones who are volunteering their time.
I'll speak on this too. Is one of the stories that was up there for you guys to read was a story that I took. I interviewed the patient, and the last question I asked him was, where would your health be at if it wasn't for the services that you receive from the clinics? And he was kind of dumbfounded, and he just said, wow, that's a great question. And at the end of it, he said, the people here, the staff and all the volunteers, they really, really care about you, and they want to see you doing better. They want to see you becoming healthier. And it shows, and Liz mentioned it earlier, with all the people that volunteer and even all of the staff at the clinics, they're there because they want to be there. And that really shows through their patient care. Another one is a doctor recently who had a patient who wasn't answering their phone, and he did a well check on them. He sent the authorities. He went over to their house. He showed up, and, I can't say a doctor's ever done that for me. So same, if not better, care than you would receive.
It is interesting because, healthcare, there's this notion that you've got to turn out so many appointments and so on. And I think all of us have heard that narrative. And at the clinics, we don't care if you see 2 patients today or you see 20. We want you to do it the way that you do medicine best. And so the doctors have that freedom because it's not about, billable services. It's about caring for the whole person. And so it's a very different environment in that way, for sure. And relationships are built and kept in many cases. But I can tell you that your specialists are our specialists. Mm-hmm.
Thank you so much.
We could talk too long.
This is such a wonderful service in our community.
Hope we didn't stay too long.
Thank you for being here. Appreciate it.
Thank you.